Are you wondering about what warning signs you need to be looking for in pregnancy? Well, today I'm going to touch just on that. But before I begin, my name is Midwife Kira and I believe in truly natural birth because I know it makes for better birth experiences. Consider subscribing to my YouTube channel and joining in today's conversation about warning signs in pregnancy. When it comes to the first trimester, there's a couple of things that would be warning signs that you need to be concerned about. Anytime in pregnancy that you have any type of vaginal bleeding, it's really important that you contact your healthcare provider. Although in the first trimester, vaginal bleeding can actually be relatively normal, the fact is that it does require some kind of a follow-up by your healthcare provider. Many times we can run lab work to confirm that your pregnancy is healthy if you're in your early first trimester, but in your second and third trimester, vaginal bleeding can lead to something extremely dangerous. It could point to other things that we need to be looking for. So one thing you definitely need to know is any vaginal bleeding in pregnancy needs to be taken very seriously and you need to contact your healthcare provider immediately. But other things that many people don't think about is like morning sickness and how it can lead to severe dehydration in pregnancy. So a warning sign in pregnancy that you would need to contact your healthcare provider would be if you're vomiting excessively for over 24 hours, like if you're not able to keep down any fluids for 24 hours, it's time to go to the hospital and get an IV. Now, because you're pregnant for 9 months, it is common to come across like a stomach virus or two during your pregnancy, not just morning sickness. So you should know that it's okay if you can't keep down foods for 24 hours. But again, if you can't keep down fluids for 24 hours, it's time to consider an IV for some extra hydration. Because remember, you are growing a tiny little life in there. You need to be hydrated to do that. And nobody likes to be dehydrated while they're pregnant anyway. That's pretty darn miserable. Pain in pregnancy is also another very worrisome warning sign. It's very common, believe it or not, for women to pop up with kidney stones, appendicitis, or gallbladder issues during their pregnancy, like gallbladder stones, for example. The thing is we don't really know what the pain is coming from until you receive a medical evaluation. So if you're having any kind of pain that's not likely gas pain in pregnancy, it's really important that you contact your healthcare provider. Now, if you're in your first trimester and you're having excessive pain down to your pubic bone, you need to go straight to the hospital. Don't wait for your doctor to call you back. Fever in pregnancy is also another concern. So while we're growing a tiny little human in our bodies, it's really important that we keep our temperatures pretty stable. This is why we don't want you to get into like a hot tub or a sauna while you're pregnant, because it's important that we keep our temperatures down. So fever in pregnancy is kind of treated the same way. Now look, as a midwife, I'm not a huge fan of like Tylenol, but when it comes to fever in pregnancy, Tylenol is one of the best things you can do to keep your temperature stable. So the warning sign that you need to contact your healthcare provider would be fever that doesn't go away with Tylenol, particularly if you have the flu and you can't keep your fever down. Premature labor signs, cramping, contractions more than 6 an hour that wrap around to your back. They're getting longer and stronger and closer together and you are not 37 weeks. These are reasons to contact your healthcare provider or just go to the hospital to be evaluated. And don't brush it off and think, oh, I'm 24 weeks and this can't happen. Guys, premature labor is a real thing, and the sooner we can diagnose it, the more likely we can help keep you pregnant a little longer. So again, premature labor is really important and you really want to get evaluated. After 32 weeks of pregnancy, it's important that you're feeling your baby moving every day. And so if your baby's not moving normally, I would try maybe drinking like a glass of juice, laying on your left side and doing kick counts. What we're expecting is 10 kicks in baby's busiest 2-hour period. And if baby is not getting those 10 kicks in 2 hours, it's really important you contact your healthcare provider and go get evaluated. Now, before 32 weeks, we do expect you to start feeling your baby, but it is normal to not feel your baby every day or regularly at that time. So you really want to ask your healthcare provider at what point would they want you to do fetal kick counts to make sure that we're keeping an eye on movement. But in general, I would say at least at 32 weeks, if you're not feeling movement regularly, you need to contact your healthcare provider. And of course, if you have any car accidents, trauma, falling down the stairs, tripping on your dog, falling on your butt, it doesn't matter. If you're having any kind of physical trauma during your pregnancy, particularly a fall or trauma to your abdomen, we want to evaluate you and evaluate your baby to make sure there's not some kind of internal bleeding that we can't see, along with other things. If you have any concerns, please don't post any current concerns in the comments below. If you're concerned about any of the things I said in this video and they're happening to you right now, it's really important you contact your healthcare provider. But otherwise, if you guys have any questions about warning signs in pregnancy, feel free to post them in the comments below. Otherwise, I'll see you at one of my other Midwife Monday videos right here on the screen. Thanks for watching this Midwife Monday. Bye-bye.